Cam followers, we are back. I have got an amazing guest for you tonight. It is the awesome Professor Daniel Mills is back with us. He's been on Cam twice before, and what I will do is put the links for our previous conversations, because we got carried away, didn't we? And we ended up having to have 2 sessions about one topic because there's so much to talk about. But tonight we're going to kind of let things flow. So please do ask questions. We're going to talk about some cases, and hopefully we will tackle different elements about this pain and behaviour connection as we talk. But before that, please, can you tell everybody about yourself, Daniel? So everybody has faith in what you say.
I'm Daniel Mills. I'm a vet and I specialise in behavioural problems based at the University of Lincoln. I was in general practice before I moved into academia, and before that I worked for the PDSA, and it was really sort of working for the PDSA that helped me appreciate the importance of owner education. A lot of the problems we saw there, I was thinking, you know, we could go a long way with better owner education. Brilliant clients, and that's sort of what, yeah, I think dragged me into academia, and that's where I am now.
Okay, let me just get rid of the squeaky toy. Sorry, the dog is with me. Luna.
I thought it was the broadcast.
No, it's always the way, isn't it? Just as you go live, they go and find the squeaky toy. Anyway, I didn't know you did the PDSA. That's new to me. That's really interesting. How long did you do that for?
Just over 3 years.
Okay. And did that fuel your behavioural interests? Was that like a big cementing block?
They were very good. When I had an interest in behaviour before I finished university, and I was seeing a few cases even before I graduated. And then when I moved to the PDSA in Plymouth, I told them about my interest, and they said, well, you can do behaviour clinics across the southwest, because they were divided into the regions. And so I did clinics in Plymouth, Bristol, Cardiff and Swansea. And we used to go and visit them on a sort of regular basis. So they were really good to me. And then sort of
your interest.
Yeah. And it's really interesting. One of the interesting things working for the PDSA is, as you know, and if people aren't aware, the PDSA offers free veterinary care for those that can't afford private care. So you can't refer, and B, your clients aren't paying anything. And you know, vets have for a long time felt guilty about charging for their advice, and trying to motivate people when they're not paying for the advice is, you know, it can in itself be a challenge. So one of the things that quite a lot there was, you know, learning how to motivate people to bring about behaviour change rather than just do this, do that. You know, there's no point just telling somebody to do something. They've got to actually be able to implement it and motivating them. And that got me going into that area, how you motivate people to do things.
I think that's fascinating, actually, because I did a podcast this afternoon for a lady over in America, and this was a real big topic that we spent time talking about, which is adherence, compliance and concordance, trying to actually make the client part of the decision-making process, to give them that kind of level of responsibility that they're part of the plan. They're not just being told what to do, they chose to do it as part of the plan. So they've got more involvement and responsibility, because trying to get people to fulfill a treatment plan, be it behavioural or physical rehab, is very hard. And I think the behaviour sector, we have the same problem in the rehab sector. We'll give people a list of, please do this, please don't do this, please introduce these, you know, therapeutic exercises 2 or 3 times a day, and you come back 2 weeks later and it's like, nothing's been.
Yeah. There's a really nice model called COMBI. It's about behaviour change. And the first thing to appreciate is that bringing about behaviour change in people is a process. It's not an event. So it's not just a question of reinforcing them for bringing about, you know, you've got people in the early stages well, in the very early stages of behavior change, people are not even aware that they need to change. That's what we call pre-contemplation.
Mhm.
And in a behavior case, we sometimes have people who are in a state of pre-contemplation. Obviously, one of the owners has to have contemplated change, because otherwise they wouldn't turn up, but their partner might not really see the dog's behavior as a problem. And you get the same exactly with arthritis as well. No, it's not really an issue, it's just the way he is. Yeah, they don't see it. So and if you think about the process of change, you've got that pre-contemplation. Contemplation is, they think there's an issue there and they need to do something about it, but often they're filled with self-doubt, and so they don't actually start to do anything, because they just say, well, yes, but, and you get that yes, but side an awful lot. After that, they move into a preparation phase, and that's really important, particularly when it comes to behavior problems. And I would equally say with the arthritis management, because if you're going to get somebody to engage in a behavior modification program or make quite big changes to their lifestyle, they need to be prepared for it. Most owners are not proficient trainers, and that's not a criticism of them, but they just don't, they go to obedience classes. But if you then say, well, actually we're going to have to do a behavior modification program, they need to get skilled up. So you can't begin that process until they're skilled up, and that's what you do in the preparation phase. You then have the action phase, which is where you instigate what it is you want to do. And then you have the maintenance phase. And what's really important in that maintenance phase is they have things like helpful relationships to keep them going until they are sort of confident and independent. Yeah. Because they're starting from a position of great doubt, or maybe even sort of disbelief that anything can be done. And you take them on that journey. So in the early stages of behavior change, people need much more cognitive support. In the later stages is when they need more reinforcement, because it's only when they start changing and things going well that you can drop in the reinforcement.
Yeah.
And so it's important to understand that whole cycle. But I think that's what's called the behavior change wheel by Jim Prochaska, who does a lot of work in addiction work and alcohol and tobacco.
1 minute, Daniel, just 1 minute. It's echoing quite a lot. I'm going to try putting these ones on and see if it stops, because a couple of people have said that you're a bit echoey. I'll try to end, and then we'll see if it's me, because it has been me a couple of times. 2 seconds, guys. We did practice earlier and it was fine. Yep. Let's practice again. I'm going into traffic control. Traffic control. Can you hear me?
I can hear you. Is the echoing for people?
I don't hear the echo anymore, so hopefully Julie will turn around and tell me. I've got the Cambasters are on the scene. They're always there, which is great. Yeah, for me it's a lot better, so it's probably my end. I have got this on. But I love the fact that we're going straight into this area, because it's common across all chronic disease. It's not just behavioural, it's not just rehab, it's anything that takes time. And Alex German was talking about weight loss, and he was saying that at the University of Liverpool, only around about 50% of these owners that go on these weight loss plans with their dogs actually ever hit target. And of them, only around about 20% actually maintain target weight. So it doesn't matter what we're dealing with, we've got owner consideration.
So that's where the COM-B comes in. So when you think, so there's the cycle of change, which is the stages that people go in according to where they are. Yeah. Mm-hmm. When you're thinking about whether or not you're going to bring about behavior change, what the COM-B model is there's 3 things you need to think about: whether or not the person has capability, which can be psychological or physical. Psychologically they may not be capable, or physically they might not be able to do what you're asking. M is motivation, which can be internal or externally affected, and it can be reflective or it can be sort of habitual. So if somebody's got into a certain habit, you've got to be able to break that habit of their response. This is the way that we do things. So yeah, particularly with things like overweight dogs, we just mentioned about the PDSA. The other thing I did at the PDSA is I did weight clinics as well. And yeah, it was challenging to get people. But so, and especially with things like weight loss, as humans we use food to give dogs treats, and we use it as it means it's important to us socially. Whereas with dogs, it's not important socially. They eat, but at the same time, dogs are highly motivated to fit in with their person. So if you offer a treat, the dog is motivated to eat it. And so, you know, there are problems with people's habitual responding as well as their reflective motivation.
Can I just point? I remember years ago, somebody said a study came out where they compared giving a treat with giving attention. So they compared in a but I can't remember if where that study.
There was a study done whether or not dogs preferred their owners or whether they preferred being given treats. And the results generally indicated that the dogs would prefer to go to their owners than the treat. But, you know, dogs do work, I say, incredibly hard to try and fit in with us. And this is something we need to be aware of, that, you know, that they will look to please us in lots of ways. But anyway, let's go. I must finish what COM-B is. So we've got capability, motivation, and the O is the opportunity. And that's the other thing, is some people are not in an environment that provides them with the opportunities to do what they want. And the B stands for behavior. So when you're thinking about trying to bring about the sort of change, or even yourself, if you're thinking about what's holding me back from being able to be successful in bringing about the necessary behavior change in my dog, I know he's got arthritis, but, you know, I just find it difficult to do what the vet is asking of me. Ask yourself, you know, are there issues with your capability? What's being asked of you psychologically? Is that too much? As I said, that could be the barrier rather than physical capability. Most people can cope with less walks, you know, at least physically. Are there issues with the opportunity to do what you're being asked to do? Or are there issues with your motivation? And is it because you've developed certain habits and it's difficult to break those habits? Or is it more reflective that your belief systems maybe are holding you back? How they impact on your behavior. So, you know, that it's a really neat little model. And it expands out into all sorts of things where you can start to look at different interventions and how they impact on these things. And we're starting to do a bit of work on that now.
I love these acronyms, aren't they? Because they're so helpful. Zoe Belcher was on a few months ago, and her one just blew me away, which is BRAN. So it's benefit, risk, adverse events. What if I do nothing? So whenever you're coming up with a treatment planning, what is the benefit of it? What's going to be the risks of it? Are there going to be adverse events? And what happens if I just do nothing? Yeah. And I loved that because it was really easy to talk to an owner in that way. Yeah. So these acronyms are really cool, actually, to help us. So because we're here to talk about pain and behaviour, there was a couple of things that I said we must mention. We must mention. And one of the things that I really wanted us to cover again is that we know that people can really comprehend the direct link. So that hurt, I do this. But I think there's a lot of confusion when it gets a little bit more complex, where there's indirect and there's just supporting a behavior pattern, but it's not directly linked. Am I able to just ask you to just expand people's minds about this? Because I know that there's going to be somebody on here and they've got a dog and their husband, for example, can't see the connection because they can only see a direct link. I touched him, he bit me, I get it. But when you have that indirect, can we give them anything that they can go away with? Say, well, Professor Daniel Mills said this.
Yeah, I mean, one of the things is, and a lot of the problems that we see, they are exacerbated by the pain. So a lot of behavior cases that we see, funny, I'm getting an echo now. Maybe I should try putting on a headset as well. If it carries on, if other people are getting echoes, let me know and we'll pick up from there. But yeah, so it's throwing me the echo. Yeah, so it often exacerbates the situation, and in that, so the animal is scared of something. but the fear is so much worse because every time it gets scared, it tenses its muscles, and when it tenses its muscles, it's got sore joints, and that makes it painful to move. Therefore, now the fear is that much worse. And I mean, there's a case we're dealing with at the moment. We started to see in lovely couple, absolutely stunning dog, black Labrador, really, really nice dog. And he came to us because he sort of had this noise fear that they couldn't get to the bottom of. And he'd been to see another behaviourist who, to his credit, had suggested, that pain might be involved and maybe they should try a short pain trial. Well, they only tried pain meds, I think, for 1 week, and then concluded that, no, it wasn't making any difference. This was just around about the time of Christmas. Well, the dog's life is thrown up in the air at Christmas anyway. So, and when you're going to do pain meds, as you know, it can take a long time before you see any effect. And it can certainly take a long time to find the right medication for the dog if you don't know exactly what's wrong with it. But this dog had so many of the classic signs for its noise fear associated with pain. And it was interesting because the owners had put in the history, we know he's not in pain. I started the consultation with them and just went through clarifying a few points. This dog was, had really generalized his fear. So he wouldn't, at times he just wouldn't go outside now, even in the garden. He'd been given good advice for desensitization to the noises, to get him used to it. It just hadn't worked at all. Again, it's not, if somebody's been given good advice and the owner tells you that they've tried to implement it and it's making no difference, I'm not somebody who says, well, the owner's just lying. Historically, I think that's what some people have thought. But the owner is paying good money, they're going to try it, and they'll say, well, that was just useless advice, I couldn't do it, rather than I tried it and it didn't work. So if it doesn't work, then that's also pretty suggestive that maybe there's something else going on. He had a slightly funny gait, and I said, yeah, well, that's just we always refer to that as his waddle. Thinking, well, okay. But the sorts of things that they couldn't get over was the fact that he still loved to play. Again, dogs will do that because they can suppress the pain in the short term if there's lots of positive things, but then he's going to be grumpy in the evening after he's overdone it. In the same way, you told me you went and bumped your head. Now that brought
but that was beer induced.
It's probably, if I keep talking about it, it's going to start hurting again. But if we keep chatting and we're into something interesting, you're going to suppress that. You're going to be diverted away from it. So
yeah, I use a really good simple analogy for my clients because they get it. It's that I like kite surfing, I like paddleboarding. I've got bad back, but when the wind's up and the waves are out there, I'm like, it don't matter, I'm going. And then I'll come back in the evening and I'll be okay. And then I'll start going, that was probably stupid. And we all do it. There's so many things in our lives that we do. People might go for a super long hike because the sun is out, and why not? It's just glorious. I must take advantage.
It's a really difficult one. And I think this is, and again, actually with these clients and some other clients, a spaniel I'm dealing with at the moment, a quite recent case. And we had a long conversation about quality of life. And I think it's a really important one here because I'm not somebody who says, okay, this dog has got musculoskeletal issues. Therefore, the dog should only have, or we should stop walking the dog. The owners enjoy the walk. The dog enjoys the walk, quite clearly, The question is, how do we manage it? And we just have to set expectations. So in one of the cases, what we've done is we said, well, okay, rather than going for such a long walk, let's try dividing it up and see how things go. So let's have 2 walks if you're happy with that. And equally, let's just try cutting right back on the walks initially. And then let's just start lengthening and find out where his tolerance is. So we know that he can cope with a 30-minute walk, but not a 45-minute walk. Or he can cope with these activities, but when he does these other activities, if they're playing with the ball and you know, he's doing a lot of turning and things like that, he seems to be worse. Now, that doesn't mean that we should necessarily stop those activities, but we adjust our expectations. So if we've gone on a walk and we've done that, then, you know, we need to think, okay, let's up the medication, or let's give him something short term that evening, just to, because, you know, he's enjoyed the walk. And I think that's okay. And we need to moderate it and find what works for that individual. And, you know, that individual dog, as well as that individual family that have got the dog as well, you know, and it's always that navigation process of finding what's going to work for that person's lifestyle, making them aware that they're, you know, the issues that their dog is having with some discomfort, and what needs to happen in that situation. So, but that doesn't mean you should stop enjoying your dog, or that your dog should stop all the activities that he enjoys. It's about getting a measure. And as I said, if you sort of row back a bit and then start to increase it and see, well, let's titrate for this individual dog. You know, not somebody says, well, if the dog has got arthritis, he should only go for 15-minute walks. Some dogs can cope with 15 minutes. Some can only cope with 5 minutes. Some can cope with an hour. Depends what they're used to and what their condition allows them to do. But now we're aware of it. These are the signs you need to be looking out for. So let's just see when he's worse and individualize the program for him. And, you know, let's have his diary.
This is so exciting. Like, because one of my really dear friends, Kathy Murphy, and me get embroiled in this kind of conversation all the time. What is gold standard, for example, is that the vet profession are being taught about achieving this gold standard, when a gold standard is an individualistic aim. It depends on the dog and the owner. That's their gold standard. So actually we should be careful with that terminology. Another thing that I think is definitely more apparent is this binary kind of existence where it's yes or no. Or it's, and actually we all live in a very big area of grayness. And what CAM has been, we've had our finger pointed at us before when we've said about stairs or we've said about balls. And what we've actually said is, look at what you're doing and modify it. Whereas people have interpreted it as yes or no. And, you know,
well, that's
example,
human nature, though. As our brains like categories, you know.
Yes.
And that's you know, that's all the work that I've been doing at Lincoln to trying to develop what we call the psychobiological approach to behavior problems is, you know, was partly fueled by the problems with the categories. Now, our brains like categories. That's why also people, you know, there's lots of people who've made successful gimmicks because it's got a label. And it's when you look at it, it's nothing different to what other people are doing, but they're giving it a name or whatever. So it's a package. It's therefore, you know, people feel safe and secure because you've got those boundaries. And yeah, so things that binary decisions are nice and attractive to people because they're straightforward. But the reality is biology exists on a spectrum. You know, everything is there's variability along the spectrum. And if you accept that there is that variability and that animals are individuals, then yeah, you've got to individualize. Now, again, an area which I won't go into great detail, but I'm in the midst of writing a paper at the moment. Evidence-based medicine has been really valuable for vets to help them in the clinical decision making. However, in the human field, it's well recognized that it was developed as a method of teaching medicine, and it's become a method of practicing medicine. And the result is, what evidence-based medicine does is it favors simple interventions, usually drugs, because you can easily do a double-blind placebo-controlled study with a drug. Can't do it with something as complex as a multimodal intervention managing dogs with chronic arthritis. And so I think we're now at this turning point. And yeah, chatting to you makes me realize it's not just the behavioral medicine field, but yeah, the arthritis field is another great example where the misuse and misunderstanding of evidence-based medicine is potentially going to be holding us back. Now, that doesn't mean it's a free-for-all, and there are methods that you should follow, and I will be outlining them in the paper when I get around to finishing the paper. We'll have a chat about it after I finish that. That'll be the fourth chat that we have, if not before. But but yeah, where you've got conditions that need complex interventions, evidence-based medicine has to be used with great caution. Yes, it tells us some of the things that we know will work, but we shouldn't be dismissing the other stuff because it's much more individualized. And that's where clinical judgment becomes really important.
Yeah, I think it's worth like the followers knowing a few things of the way that vets work. And I totally agree with you, Daniel, because, for example, I love manual therapies, and manual therapies will never fit into an evidence-based testing model. But I deep-seatedly believe and have seen and have had numerous other people see how effective they can be. But as vets, we follow something called recognised veterinary practice. And I think that's where evidence-based supporting foundational interventions that are known to be successful comes into play. But there is a layer upon top of that where you go, well, I've got my non-steroidals on board. They've got a huge amount of evidence of being effective. They are the treatment of choice because of safety, efficacy, etc., ease of use, ease of administration. But then I'm adding more things to it. How do owners work out what is going to work? And what's fascinating is we wanted to do a series for owners to learn to become critically appraising, so they could actually explore these different areas with the vet saying, I think this may work, I believe this should help, but I can never tell until we try it. And you are going to be the key person that tells me whether this is working or not. And this is what I want you to be able to do to help us together, my knowledge, your experience, because you're living with the dog. Where do we end up? But that's a really hard conversation to have with an owner, isn't it?
I don't know. I'm not sure that it is if you know what you're doing, because to me it's about teaching people to do an experiment on n equals 1, n being the term for population sample size. Yeah, traditionally and this is again when we do research and in traditional science, we have this population, we have this population, we compare the two. Is there a difference between them? That's sort of your classic intervention. This group had a placebo, this group had the drug. Yeah, the group with the drug got better, therefore the drug is effective. That's great. And that does provide valuable information when you're dealing. But the first thing to appreciate is, just because something works in a clinical trial where you've got very highly motivated people, you've got certain inclusion and exclusion criteria, how much does that really apply to the dog that's in front of you in the clinic today with this owner? So this is part of what I want to get across in this article. And as I said, I'm going to be working on it probably over the summer to get people to appreciate that actually it's much more, it is much more complex than this. And as I said, people being taught sort of, well, these are the things with evidence, these things don't have evidence. But actually, there's a lot of things that don't have evidence that there's good reason to think that they might help. Now, the danger is, and I had a PhD student who looked at head shaking in horses, and there's an enormous placebo effect. And if somebody does, the problem is if somebody tries enough different treatments, a lot of animals get better anyway, and they have periods where the condition, like chronic pain, waxes and wanes, and in horses there's a seasonal nature to it. So if every 2 weeks or every month they're changing the treatment and the horse in this case seems to get better, then they believe that they believe that what they did made the difference when it was just random. And I say to my students, if I tell 100 horse owners the next full moon to dance naked around their horse and put a dead toad in their horse's ear, then some of them are going to think that I'm a complete magician, because they're going to see within a couple of weeks their horses get better. But it was just going to get better anyway. And that's danger, so what we've got to try and do is avoid that situation where these treatments that are not effective, people are advocating against them because they have the personal experience of, I tried this and the horse got better or the dog got better. And what you have to do then is you have to have the conversation with the owner and say, right, okay, this is your dog. Your dog is an individual. We have these treatments and we have these supplementary treatments. And, we're going to use your dog we're going to experiment with your dog to find out what works for your dog.
Trial.
Yeah. But the way that we do it is, it's not just a question of we see this and this gets better. We actually have to know that it's not just a spontaneous situation of spontaneous recovery. What we do is we'll try things, we'll structure it so that it makes sense, where we can introduce one thing or a couple of things that need to go together. Yeah. Mm-hmm. We will see if we get an improvement. We get good. We always give our owners diaries to complete, and they are scoring numbers so we can plot. And these graphs are really important to us, and they're really important to owners as well. So we'd introduce this treatment. Let's see what change we get in the numbers. And literally on the plot, does it go up and down as a result of it? And then actually, if it looks like it's working, let's try withdrawing it and see what goes on. Or let's withdraw one element. And, now people say, oh, yeah, but I don't want my dog to suffer. Well, he won't, because it might not be necessary. And we're trying to find what's going to be least cost to you as well. And most owners will go on this journey. And as I said, as we were talking earlier, trialing different lengths of walk. Let's see what works for your dog. You're the owner. You're the specialist in your dog. If you're the owner, you're the specialist in your dog. Yeah. I'm the specialist in veterinary behavior. You're the specialist in arthritis management. Yeah. But you're not the specialist in your client's dogs. They know their own. And once they've been briefed about what to look out for and the things to be aware of, owners are really good at this. And they really, in my experience, they really like engaging with it because they're learning about their dog. And, one of the things we often say, people come with problem behaviors to us. We want them after the first clinic visit to us to no longer see their dog's behavior as a problem, but a learning opportunity for them, a way that they can learn more about dogs as well.
And that's very similar to our state. Yeah, we say that arthritis isn't the end of the road, it's just the start of a new direction, because we want to make sure people don't see it as just this negative doom and gloom. The only problem I will say, because there's going to be vets and nurses and therapists listening to this going, oh my God, but you don't have my client base. And one thing we do need to remember, and I've fallen into the trap of, people listen to CAM because they are very engaged, and people come to you as a referral because they are heavily engaged. And there is still a very big population of people out there that do love their dog, but they love their dog in a different way. And I know that as a first opinion vet, there's been countless days where I'm like, I'm really trying to help you, and you just don't seem to want to take on my advice because it's physically taxing, time taxing, financially taxing. So just for the vets that are listening going, what are they saying? I do totally respect that there's a wide variety.
Absolutely. And you've got to think about different strategies for different groups as well. And I freely admit, the people that we see are a very small subsection of the general population and not representative of it. But you can offer first, if you go back to what we were talking about earlier with the cycle of change, the first thing I think for perhaps a very large number of people, and this is what I think you've been absolutely brilliant at doing, is shifting people from pre-contemplation to contemplation. Before you came along,
I haven't done it. Do you know what we've done? What we've done is we've got other people to do it for us, because I always, whenever I'm lecturing, I always say Mabel by the poo bin has so much power. Mabel, who walks a dog around the park, she can tell anybody anything and they'll believe it because she's an influencer. And what the good thing about Cam and Holly's Army is that we've made the people that have benefited from advice become the influencer, and they influence the next lot and the next lot, which is fab.
But you've also influenced the profession. That's why they gave you an award in recognition of what you've been doing. So you're being overly modest, I think, the way that you've been bringing about. So, it's for vets as well. There's a problem with appreciating the nature of the issue. So, there's a need for that shift from pre-contemplation to contemplation. And, according to where your client base are, you need to think, okay, if you understand the process of change better, and you can divide your demographic into it and think, okay, for some clients, I need to make them aware that there is stuff that we can do for them. Okay. And then, a proportion of those might start to engage in the process. But if you just try and treat everybody as action, I've got this drug, this drug will make your dog better. Those clients aren't prepared for that yet. So you need to work on it, and you need to think about how are you going for your practice. Yeah, how are you going to take people on that journey?
No, I totally agree. And that kind of leads nicely to where is the future of vet medicine? And I think that all of these chronic diseases need some professional experience presence online for people to tap into 365 24/7, because I love being a vet. I'm still very proud of being a vet, but I know that the current paradigm that we're in is quite limited. You know, 10 to 15-minute consults in a practice with a slippery floor, with busy reception, with huge pressures on the staff. That wouldn't it be nice as a collective if we provide the resources? Like we've already got it with ISFM. An incredible resource, and it would be good to have other things also represented well online by the professionals that have got a huge amount of experience to give that advice, because unfortunately there's a lot of advice online, but it's not necessarily up to date and as reliable as we would like it to be.
But this goes back to, I mean, just thinking about the whole way that we run our businesses. Yeah, and as you say, many practices run on this idea of 10-15-minute consultations. This is how we do it, and this is the way that it goes. Well, this is one of the things that was a real advantage for me from the PDSA, and we're going back to 1990, so a long time ago, and I appreciate the world has changed since then. But one of the things that we did was, we had the standard consultations, and I think we had 2 every 15 minutes was the way that we tended to operate. Yeah. 2
every 15 minutes, like 7-minute consults.
They were, I think that's the way that we operated. I think it was, so anyway, but by doing that, and, for some clients, it was very short and sweet. But if you think about your business model and think, okay, what I'm going to do is let clients know that these are our standard consultations, and then we have these other forms of consultation as well. So I said, I did behavior clinics, I did weight clinics, and we would invite people in, and they would be much longer consultations for that. Now, at the PDSA, because it was the charity, we didn't charge, and I don't know exactly what the situation is now, but I know that when I graduated, vets did feel guilty about charging for advice. I think there's less of an issue now, but I think there still is an issue. But if you say to a client, I'm going to spend quality time with you, on a one-to-one, people are used to paying for services. They go to a lawyer and they pay for the advice that is being given. This is your dog. We're going to work on it. We're going to put together a plan. And so, this isn't going to be one of the 10-minute consultations. This is going to be one of the longer ones.
I think chronic disease does fall into the longer consult period, definitely.
And let's work with it. And this is how we go about it. And, in my experience, owners will go with it, but it won't be for everybody. Absolutely. No. But, unfortunately, we do have to charge for our services.
I think, as you say, these are often long consultations. Going back to the idea of what we're going to talk about, we actually touched upon this before we went live. Librella. There's been a question. Let's dive into Librella and your experiences and my experiences, and then that will kind of like lead us into cases again. For anybody that's kind of going, just talk about pain. The idea of these lives is that you get to meet the interviewer, the guest. So if you've got questions, please ask them. However, they are chats, so they're not here as a lecture. So if you were expecting us to just talk to you about the pathophysiology of pain and all the interventions, that's not what these are about. These are about bringing the vet profession into your living room so you can see that we're humans that care massively about what we do. But back to Librella. So we've got a lot of movement going on Holly's Army about Librella. So if any of you guys are listening going, what are they talking about? What are they talking about? It's a monoclonal antibody directed at nerve growth factor, which is basically a peripheral sensitizer. So that basically means your physiological pain receptors in the tissue surrounding the area of pathology, so say the knee joint, they are being conditioned to fire sooner at lower thresholds. by this thing called nerve growth factor. So when you've got tissue damage, nerve growth factor, and it causes all of these receptors to go, oh, I'm really super sensitive, and I'm just going to fire. So what they've done is they've created a monoclonal antibody, which goes in and basically the nerve growth factor, so it stops this peripheral sensitization, which diminishes central sensitization. It's like people are going, oh my God, this is a game changer. This is incredible. You know, the progression in pain management with the introduction of this is going to be huge. What's your experiences?
Very limited at the moment, to be honest. Because we were late meeting up, so I didn't get to tell you. But you know, yes, I agree with you. I think it's a game changer because it's a completely different mechanism. Mm-hmm. And the sorts of chronic cases that we're dealing with and you're dealing with, this is the sort of thing that we need, because you get this sensitization process going on. And whilst it's obviously been developed for those the chronic arthritis field, actually nerve growth factor has a much bigger role in all sorts of other pains as well. Mm-hmm. So I'm quite excited about, and I've got a couple of cases at the moment that I'm just starting out on it. And yeah, I'm going to be intrigued to see how they get on with it. But I think it is, it's, as I said, it's a new drug. The other thing about it is it's given as an injection, so you know you're getting a month's treatment when you get the first shot. Because again, you know, too often, as I mentioned the case earlier, you know, the owners decided after a week that they weren't seeing any effects, so they stopped the treatment with tablets. I just think, no, please don't. You know, just give it a decent length of time. Let's see how things go, because yeah, these things have been going on for a long period of time. They take a long time to undo as well.
Yeah. And I think we saw that when Tricoxil came out. So that's Mavacoxib, which is a long-acting anti-inflammatory. And I think the vet profession were very scared of using it, because the idea of putting an anti-inflammatory and then not being able to control it or stop it, and you maybe have something else happen. But what we definitely saw were these dogs were improved because the owner was taken out of the picture. The owner was taken out of the equation. So we weren't having changes in, some days he got the full dose, some days he got half dose, some days they forgot. And this Mavacoxib would be on board for a month, and it was done and dusted. And a lot of these dogs did really, really well. So it's got the similar kind of concept where the owner and their concern about dosing is taken away. Yeah. For us on Holly's Army, just so people know what's happening so far, and I'm going to be a proper sit on the fence. I am going to say both sides. It looks amazing in that what people are reporting is very, very positive. We're seeing behavioural change within the first couple of weeks. We're seeing dogs that become more engaged, more sociable, seem more enthusiastic. The negatives that I'm seeing, and this is my opinion only, so please don't hold me to task. Firstly, I think there is beginning to get a little bit of placebo effect potential, because so many people are saying how amazing it is. I wonder whether there is an influence on other people's opinion of what they're seeing in their dog. So I think we need to be aware that it's being marketed as a new thing. People are talking about it being a wonder drug. Don't let it cloud your judgment. Watch your dog. You know, there's not many people yet stepping forward and saying, I didn't see any benefit. And that worries me a little bit, because that's just against nature. If everybody's going, yes, it's amazing, you're like, that's not possible. And the next thing is a lot of people are aware that their dogs feels that their capabilities are more than they're physically able. So we've got dogs that are now trying to jump back on the sofa, but their tissue is not ready for that. The tissue hasn't been rehabilitated. So there's a concern, is it actually potentially going to do more harm? That's all very much in its infancy. It's such a new drug out. So that's very cool.
Are you capturing all these reports through Holly's Army? Are you actually generating data from it?
I'm not, because I actually haven't got a minute to spare, but it's all there. It's all on the platform that we can drag it out, and it's all real-time data.
But can we, I mean, I'm quite happy that, you know, I've probably got students. We can make a database that people can ask questions, and people just log yes or no answers to these questions.
Holly's Army is there for the data collection potential now. We've got 7,000 owners on there now.
So, I'd be really keen to try and capture some of that. And you mentioned that there are behaviour changes. I've got a couple of students actually on the masters that we do who both want to work in the area of pain for their dissertations this summer. Let's work together on that and get this. Let's capture the data and see what people are saying, because I think it's really important.
And the timing of how long before people are starting to see benefit. Just to answer some people's questions, what's the long-term effect in organs? There is no reported side effects, and all of the pivotal and pilot studies, they didn't see any deleterious impact. Can it be used with cancer? They haven't trialed it in cancer, so there aren't any studies that I know of that they're using Librela for osteosarcoma, for example. But when you look at the pathophysiology and you look at what it does, it would make sense that it will have an effect, but don't expect that you're going to find that data anywhere yet. Can it be used with dogs with non-steroidal sensitivities? Yes, it can do. However, you've just got to monitor your dog. Nothing ever comes with a promise, but yes, it is something that you could look into using. Somebody else, can it be used with young growing dogs with joint problems? It's not licensed under 12 months. So the licensing doesn't exist for under 12 months and it doesn't exist for under 2.5 kilo. So if you're over the border on both of those, then yes, it's got potential to help. And somebody else said, can it be used earlier or later? The belief is actually introducing it earlier, but as a clinician, the only thing that I would say in my experience for all pain interventions is the earlier that you use things, if the owner hasn't seen that the dog is in pain, they're not committed to stay on it. And that's a really horrible thing to say, but some of my most committed owners are because they've been to hell and back. They've seen how bad it can be. So they're very motivated. But when you introduce an intervention in the early stages, which is much better, they don't know how bad it can get. So they're quite lax with sticking to the plan. Is that your experience?
Yeah, I mean, it can be. And, what's important is, as I said, that owners are given choice and, giving them that autonomy to make the decisions. And we recognize that, people have to live in their own worlds and that there will be limitations. We'll do the best within the restraints. And I think this is actually something which, as you know, mental health issues in vets is a big issue because we take an oath to do the utmost for animals committed to our care. What I think isn't perhaps made clear enough for the benefit of vets' mental health is yes, you do the utmost for animals committed to your care within the constraints applied by the owner. And you've always got to remember that, so that, you can't do everything for every owner that you think needs to be done, because there will be limitations applied. And say, go back to working with the PDSA, certain drugs we didn't have access to, etc. And you have to accept. And you just, as long as you know that you're operating to the best of your ability within the constraints of the real world, and then hopefully that will act as some comfort for your mental health as well. And you shouldn't make owners feel guilty just because they can't. But what might work for one client, this client can't afford it, so let's try something different. Let's see, we have these preferred options. There are less preferred options that might work. There are these things that, if you can afford it, great. But if you can't afford it, you might have to make more physical effort of changing your own lifestyle in order to bring about the same behavior change. So, if you can afford it financially, it's more convenient. And, you just have these conversations with owners and, don't try to, whatever you must do, you mustn't, try to guilt people into taking part, Owners, their circumstances, we respect what their circumstances are. Let's work with you and see what we can achieve together.
I tell you what, I'm going to do a quick plug for Sagi's new book. I'm reading it at the moment, and I love it. And it's carefully organized so that you read the stuff that you probably would miss if it was at the end of the book. You'd kind of go, oh, I don't need to know that because I'm a vet. I've been a vet for years. I'm not going to read that. I want to just go for the hard stuff. But he's put those reminders about owner communication, getting the best out of a consult, you know, the bigger picture. It's not just about the disease. It's about the owner, the animal and yourself. The reason I'm saying this is he mentions using questionnaires a lot more to get the value out of a consult. And any person listening, any owner listening, remember this. If you get the opportunity to condense and collate your data before you go into a consult, it's so important to take it. But what I've found as a first opinion practitioner is a lot of people don't see the value in it. And they're like, oh, I can't be bothered. I'm not going to do that. I'll just tell him when I'm in there. But actually getting value out of this 15 minutes by collating your data into a questionnaire beforehand is so valuable. You use it a lot for behaviour because it's second nature to you guys.
Yeah, and we've developed a number of instruments with regards to that. And what's interesting is one of the instruments the first instruments we developed is called the Positive and Negative Activation Scale, and PANAS. And the reason why it's called that is because there is a human equivalent. That was what inspired us. But as we've used that more and more, so looking at the positive activation, which is basically your sensitivity to rewards. Negative activation is your sensitivity to the aversives. And people have always tend to think sort of aversives at one end of a spectrum, rewards at the other. They're not. They're actually 90 degrees to each other. You can be very sensitive to nasties and very sensitive to rewards within an individual. But looking at that scale as we use it, we've now sort of from a clinical point of view, dogs that are in chronic pain, within the positive activation, there are a number of subsets. So one of them, for example, is persistence. So they might have normal positive activation or slightly low, but it's the persistence that is particularly low within that subset. And that's because, they're doing things that they enjoy, but they can't stick with it for as long. And there's some of the indicators that we use to try and pick up we may not have been able to nail exactly, that this dog is in pain, but then we start to look at these scales and we do much more. I was chatting to, I have a visiting position at Nottingham Vet School as well, and I was lecturing the students there on the house soiling. I was trying to get through to them, yes, you're going to be in a 10-minute consultation. Get an owner who's got a urine spraying cat to draw a floor plan, because as soon as see where the cat is actually doing it and where its litter tray is, you can ask them to add other bits if you need to, but an owner can quickly sketch that and you will gain so much information. And I fully agree, and perhaps also sort of with COVID, people are doing much more online stuff, and so owners are really keen to record much more and collating that information, as you say, in advance and making sure that it's there. Trying to quantify things.
So if any CAM ambassadors are listening, which you always are because you're amazing, can you please put up the link for the suspicion of chronic pain PDF, the chronic pain indicator chart, and the what has changed for my dog? These are resources that we encourage owners to print off, fill them in and take them to your vet so you can start working with your vet much better. CAM really sees itself as a support system when definitely not a replacement for your first opinion vet. Just because we're coming towards like 55 minutes, I know.
We start talking about what we're going to talk about.
I know, it's crazy, isn't it? Just trying to help somebody out who's saying, okay, so my boy is 15, Cocker Spaniel, he's generalized stiffness and is variable depending on what running about he's done. He can jump onto the sofa when his mood takes him. He's on U move. My vet doesn't feel his range of motion is good. And then she later says that's what she means. The vet feels the range of motion is good. But so she's seeing her older dog, Cocker Spaniel, 15, seems really stiff. He's on a supplement only. What else can I do to help him? Have you got stuff to add to that?
Well, it's so individualized, and this is it. So, I mean, he could go on to all sorts of medication that might help. he might benefit from physiotherapy again. But if you can't afford physiotherapy, have you got somewhere that he can safely go do a bit of swimming? You know, that sort of exercise. Make sure he's not being exercised so much on hard surfaces, if it's possible, you know, rather than street walking, getting him out into the fields. But for some dogs, out in the fields is an uneven surface. That's going to make it worse. So, you know, play about with it and see what he responds to, I think, is the key thing.
Definitely. And I think there is a terrible tendency for us to always assume that stiffness is painful. And I've been taught that a lot by people like Tom Harcourt-Brown. You know, Hannah, not everything that you see is stiff is pain, Hannah. You know, open your mind. I'm like, yeah. Sorry, Tom. So actually making sure that your vet has imparted their feelings of, is this pain related? So bring together, is there a behavioural component? Is there capability loss? Is there a continual postural problem? So just make sure there is pain related. But my little ditty here would be, this is where non-steroidals could be a perfect trial. Yes. Don't see it as for life. Don't have that fear and think, oh my God, if I start this, I'm going to be dependent or hooked on it. But you might find that you do a 2 to 3 month trial on it and it answers your question. Is there a pain component here? And I think that's a really good use of non-steroidals. But have a chat with your vet. One of the things that I've found since I've been doing this for the last 2 or 3 years is a lot of the questions that come up are things that owners should talk to their vets about, but for some reason they're inhibited. Maybe it's time, maybe they just don't feel that they can ask that question. Please do go back and speak to your vet. They've touched your dog, they've seen your dog. We're just pulling from the air without having seen your dog. More questions. We're doing okay, I think. Lynn's on it, she's put the uploads up there. Okay. So what should we do? Should we do one pain case and then tell you to come back?
I don't know. So let's go back to the Labrador that I was telling you about. So some of the characteristics for him was he would take himself off when he was scared. And again, that's one of the things that we often see in these cases, that when he's scared, the dog takes itself off. It doesn't seek out the owner. And we think one of the reasons for that might be that if it goes to the owner, he's likely to get cuddled. And if you've got sore joints, the last thing you want is somebody to bundle you up and make matters worse. And so often these dogs will do that. I mentioned about the generalization of the learning as well, that he has a bad experience. And, you know, it's normal that if you have a bad experience that you sort of extend it a little bit, but it's not normal that anything even vaguely associated with the event is completely avoided. And these are the sorts of flags that are there. And you've just reminded it, I've got a video to give you. I'm going to tell you about it. So my dog had a noise phobia. So Holly, rest in peace. And when I read your paper, Noise Sensitivities, my heart sank because her noise sensitivity was way there before I realized that it was pain. And it was totally linked to neuropathic pain from lumbosacral stenosis. So I'm a little bit of a vigilante about noise sensitivities now because I messed up with my own dog. And recently I was in my camper van with the Luna and we're in a thunderstorm and I have caught on camera, and I'll send it to you. It's like a horror movie. You hear the thunder, you see the flash of the light, and then I spin the camera around slowly and Luna is asleep. And for me, it was just mind-blowing because Holly's sensitivity to thunderstorms, fireworks, bottles clashing, doors closing, car doors closing, backfiring cars, anything was her turning into a within seconds. So having this younger dog that's like, I was like, oh my God, this is just beautiful. So one of the really important things that we use for a lot of cases, and it's a really simple thing, and it's one of those things which, you know, the more that I talk about it, the more important I really realize it is. You know, if every dog should have a lead, it should have a it should be fed, it should be watered, and it should have a safe haven in the home. And I want to explain what I mean by a safe haven for those that don't realize it. So in the idea of the safe haven, I started to develop because I realized that doing things like desensitization and counter conditioning is really tough. So if in the human field, it's having a safe haven and a secure base is really important. And basically what it is it's a place you know you can go to and no harm will happen to you. It is not the bolt hole cupboard under the stairs that the dog runs to whenever there's fireworks, hoping that they are going to pass. Yeah. The difference between a safe haven and a bolt hole is a safe haven is a place you go and you know you are going to be safe. A bolt hole is somewhere you go hoping you will be safe. And there's a big difference there. And then the other really nice thing about it is you can train this away from the problem situations. You don't have to expose the dog to noises in order to get it used to noises. You train it to the safe haven. And there's a sort of few key stages to this. So the first is, well, I'll start actually with the last rule first. If people can't understand the rules, they cannot be left alone with the dog unsupervised. Okay? That's the first thing. Okay? You don't want to get it wrong. It's often easier to build a new association. So the safe haven can be, if the dog likes to go under things, then yeah, you can create a new den for the dog or something like that. But for many dogs, just a distinctive bath mat. You can, go to the pound store or whatever and get a bath mat that is different. And the nice thing about a bath mat is you can take it with you. So now your dog has got a safe haven that it can go to. And owners should also be secure bases for their dogs. And we can talk about that afterwards. But you're not always going to be with your dog necessarily. So you've got this distinct area and you have these simple rules that if your dog is there, then first of all, not only will no harm happen to your dog, but your dog is in complete control. So your dog makes the decisions. You never impose on your dog when he is on this mat, this safe haven. So if your dog is there, you don't go up and give him a pat because that would be intruding into his personal space. And he has to have the control to know that if he's there, that is it. His personal space is typically probably sort of between 1 and 2 meters. So the dog has to be able to take himself away. Okay, it can be around the back of the sofa. Those dogs that like to, hide away, then, move your sofa forward and decide that's going to be your safe haven. So you can leave treats there when he's not there to go and find them there. That's absolutely fine.
I think that's
it's go through this because, as I said, otherwise I'll forget the list of things. So just hold on. Because these are the sort of mistakes that people make, and I want to make sure that so you can ask your dog when he's on his safe haven, do you want to go for a walk? If he stays there, he is communicating to you, no thanks. And you respect that. And this is the really good thing about it. It gives your dog a way of communicating with you. A growl is a way of saying, no, thank you, please, or back off. Yeah, please. And it's a dog trying to be polite. The safe haven is a way that you don't even have to have a growl. If the dog doesn't come off when you show it the lead, then your dog doesn't want to go for a walk. That's fine. You go for a walk on your own. Your dog has just said, I don't want to go for a walk with you. Yeah. Sometimes you might want to go for a walk and not take your dog with you. It puts the dog into this position that the dog can make choices and communicate with you. So what you don't do is go up to the safe haven and click the lead on the dog because you've removed his autonomy.
Yeah. No, I like that.
The dog must be in control there. So as I said, treats can be there, puzzle feeders can be there. Make sure it's nice and comfy. And the dog learns that whenever he's there, he's in complete control. And that no harm happens to him.
No, I love that.
You train this away from the problem situation, and the dog, when there is thunderstorms and things like that, he will take himself there. If the dog does appear initially scared, the important thing to do is not to go up and console him. You orientate to him, acknowledge that he's scared, and say, oh yeah, that was a scary bang. That made me jump too. And then you start larking around and doing stupid things. You take some of your dog's toys and you try and juggle them, and I hope you're a bad juggler. And what you don't do is go up to the dog with a toy and try and say, come on, let's play. Because the last thing you want when you're scared is somebody shoving a toy in your face place saying everything's okay. That doesn't help. But if you create if you acknowledge the dog's fear and then creates the ambience that is incompatible with fear, that this is a safe place, that's why I'm joking around, but I've acknowledged that you're scared, the dog can then choose.
Yeah. And I love them. So Beth's just said that, you know, she's been doing it with her pup and it really does work. And I was just about to say, Beth, you beat me to it. You beat me to it. Is that I definitely feel that there's a scope that we can introduce more of these coping strategies, these life skills a lot younger. And the potential for puppy socialization and training and introducing these things, wow, you know, there's a whole education as a puppy that we really
didn't I? The puppy life skills to plug.
Oh, have you got puppy life skills? Where is it? Have you got
We've
it?
developed the idea. Puppy life skills. It's somewhere. I'll grab it. You keep talking.
I'll keep talking. No, I think there is so much scope to really kind of like expand what is done in that early period. Any therapist or vet listening to this, it is our key opportunity because people are very, very engaged at that point. And I won't lie, a lot of owners love it.
There we go.
Love it. We'll get the ISBN number and get that on here. And we'll put Saggy's ISBN number for anybody that wants that book as well. Can I watch this again from the start anywhere, please? Yeah, of course you can. Of course you can. And Daniel's going to come back and we will chat again. But as I say, guys, these chats, they're not webinars. So they've not got this kind of really routine structure. One of the things that we wanted to do is we wanted you to realise that the vet profession is full of these really passionate people that love what they do. Luna, not now, please. So one of the thoughts with these lives is that you can see that we're all humans, that, you know, it's 8 o'clock at night and we're still talking about our work. And I think that's a really good thing to get across to the public, because vets do get a hard time. You know, what with all the change in corporate structure and pricing and stuff, I wanted us to be seen in our best light as passionate souls. So if you have got questions, guys, do put them down. I'm sorry if we haven't given you fact, but if you have got specific questions, I will answer them later. If you haven't joined Holly's Army, please do. At the moment, during this lockdowns and tier systems, I've been doing a live on my own there every week trying to answer your questions, which is always quite funny because I'm generally a bit waffly. So please go and join Holly's Army. What we'll do is we'll get Daniel back because he's obviously got some stuff up his sleeve with this paper that you're releasing. I want to know more about this. Until then, we could do 10 top tips quickly. Have you got 5 minutes to do 10 top tips? So that people
10 top tips, but I mean, okay, we'll just let's maybe sort of we should recap. Let's recap some of the things we've talked about. First of all, behavior change for humans and for animals is a process, not an event. So it takes time, and you need to first of all identify where you are in that cycle of change, or where and be honest with yourself. Have you been properly prepared? One of the most common things that we see is people rush into trying to change things without laying the groundwork. They're not properly prepared.
Yeah.
So with the best intention, they think, oh yeah, I'll do this, I'll do that.
Are you still there?
God.
Hello? Daniel! I think your internet might have gone. You're very serious. If anybody else is watching this and he's disappeared and he's frozen, then I do apologise. It was lucky that we were coming towards the end. He's not coming back by the looks of it. So something might have gone wrong his end. But anyway, it's okay. Right, guys. So I'd like you all to say thank you to the lovely Professor Daniel Mills. A few little updates for you. Yes, he is gone, hasn't he, Jill? Thank you for letting me know. At least we haven't got a terrible facial expression. There you go. It's just me. Right. So an update, guys, just to let you know what's going on. We've got Sarah Fisher coming in later this week. She is beautiful soul and one of my favorite people, so please definitely tune in with that one. We have got a few things coming out soon that I really want you to engage with. Just so you know, CAM is a vet-led independent support service. We rely on your support to keep going, and we've got a couple of owners courses coming out, so we would really like you to engage with them because we rely very much on the funding to keep going. We don't have any external funding support. We're not on a government scheme, and we're not kind of like veterinary industry dependent. We're very, very independent. We've got a children's book coming out as well. I know, I'm so excited. Okay, so basically my beautiful Holly that I lost a few years ago has been a big inspiration on me, and I really wanted to be able to tap into the younger generation. So we've written and illustrated a children's book that we would like to go out to any dog that's diagnosed with pain, so that the family surrounding that dog can understand how to handle that dog, so that we don't get any unwanted behaviours. So hopefully you'll support that. It's called Why Didn't You Listen? Because the dog very much tells everybody, I'm not coping, please look after me. So that's really exciting. We've got all our booklets are e-booklets now, so please go and support them. Oh, Daniel's back. Before we go, hello.
Right.
I was just filling in the gap.
I don't know what's happened. That's well, yeah. I don't know.
It's all right. It's all right. Well, we're coming to an end anyway, so it's good that you can say goodbye. Everybody thinks you're fantastic. So until then, shall we say goodbye?
Oh, that's it. Okay, sorry.
It's okay. You want to do some more tips? Do you want? We've got time. Would you like to do?
Let's. Oh yeah. Let's do. So I don't know when I dropped out from your point of view, but
we were doing your summary, and we got halfway through the first point, and then you froze.
Okay, so hopefully you finished that point off. Did you?
We were talking, and you were saying that behavioural problems are not going to be remedied overnight. You have to engage in a long-term management plan.
And recognize that, you need different things at different times. So as I said, once you've started bringing about the change, make sure you've got helpful relationships. And that's where things like this group are so valuable. People know they're not alone.
Mm-hmm.
That's the first. Second tip, make sure your dog has a safe haven. That's so important. So a place that your dog goes to and he knows that he's safe. If you put it on something like a bath mat, you can take it with you. That's the other key thing there. And it's a way that your dog can actually communicate with you. Don't impose yourself on your dog. If he's a little bit uncomfortable, let him choose and let him make the decisions. Equally, let him decide if he wants to end the walk. Don't be afraid to trial your dog on different things. Keep good records and see what works and what doesn't for your dog. See if you can identify the patterns. Bring that information to your vets so that they can see what's going on. Because if you've been monitoring it for 2 or 3 weeks, they've got baseline data, so they know what they're dealing with. It's a little bit like blood tests. Blood tests, you've got normal ranges for dogs. But your dog might normally sit at one end of it and still be in the normal range, but shifted to the other end of it. That's not normal for your dog. So I think getting good records for your dog, what is normal for him, is really important. Record your dog's gait today, walking away, walking towards you. So you know what your dog is like today as a 2-year-old dog, so that when he's an 8-year-old dog, you can see his leg never used to swing like that. Yeah?
Yep, that's a good one.
Nearly everybody's got a smartphone, so just record your dog today. Does your dog have bizarre ways of doing things, like going to the toilet? Because if he's hesitating and if he's got his own unusual way of doing things, just be aware, because going to the toilet usually means crouching and that sort of thing.
Luna.
And if he's got painful hips, that can be an issue. If he doesn't cock his leg and he's a male dog, then it might be that it's painful for him to either stand on one leg or to lift one leg, those sorts of things, you know.
Yeah.
So actually paying attention to your dog's toileting can be quite an important thing for picking up on some of these things. What
Definitely. I just to reinforce that one. So the podcast that I was doing this afternoon was with somebody who is in the dog industry but isn't in the same field as us. And when I said to them about arthritis being a secondary disease in dogs and developmental disease underlying it, so these dogs can present very, very young, and the fear, the not realizing that dogs aren't born perfect was a real shock for her. She was like, wait a minute, you know, so we're talking 8 months, 6 months, you can start having pain. I was like, yeah, you can do. And she was like, so when they doing the waddle, just because they've always done that doesn't mean that that's normal for them. Well, it's normal for them, but there can be something underlying it. And I think that's really important that people should know that.
There is, I mean, I don't know, the Helsinki pain scale.
Yes.
That is validated. Do that every 6 months on your dog. Just see if it's changed.
Yeah.
Not now, if you've got a puppy, see how things go, you know, and you can download it free online as well, so you can get it as a PDF. Any owner can do that.
Yeah.
And again, the problem is a lot of these issues creep up slowly.
Yeah.
It's only when you look back and you've got those decent records that you realize that, yeah, you know, things have changed and this is what I should be doing. And then you also, you know, where you can get to in future, you know, if with treatment, this is what it should be like.
Yes.
So that, you know,
that's a definite rehab tip, which I love. Okay, so it's so simple. It's so simple, but it just is a brilliant conversation to have with an owner is, where do you want to be with your dog? We're doing this management plan, be it behavioural, be it rehab. We're trying to get somewhere, but where is it that we're trying to get for you and your dog? What is your bond? What is your relationship? What's your ongoing, you know, thing that you're going to do together? Because sometimes we can aspire to way beyond that dog's capabilities, but we could get to a happy medium, and that's when it's going, I just want the happy medium. And I think that's really important to have that conversation. People are asking, is Luna bored? And I'm afraid I've now got a dog that when it gets to about 8:30 after these lives, she knows when they're coming to an end. And I swear to God, at about 8:15, she starts getting ants in her pants, as if to say, you're not finished yet.
Be kind to Luna then, and not keep. But the important thing is, you know your dog, keep records of your dog. You love your dog, take pictures, take video footage, keep those, but put them all together and see them also as a potentially valuable resource to help your vet to get to know your dog as well. And as I said, what might be normal in one dog may be completely unusual for another. Yeah.
Definitely. There's a few little questions going last, but I'm going to ask the ambassadors, the lovely Hannah, the Lynn, the Carol, can you please just step in and answer a few of the last ones, just to help us out? If not, I'll pick them up later tonight. The ambassadors, I'm just going to give you a final massive big up. Ambassadors are a group of dog owners that might have skills in the dog world. So they might be behaviourists, they might be trainers, they might be just happy dog owners. They give their time to support you guys. So Holly's Army and main page, they're always supervising, they're always checking at that the content is good and you're not being marketed to, or promotions and all this horrible stuff. So thank you, ambassadors, you are amazing. Okay, well, I'm going to book you in as soon as we finish this live so we can get you back. Thank you very much for your time, Daniel. It's always lovely.
Yeah, it's always lovely to chat to you too. So
cool. Take care, guys.
Enjoy the rest of your evening. Take care now.